Advocates say lots of kids in Central PA don't have the access they need to mental health services to deal with trauma, things like that. 16% of kids experience at least 2 or more traumatic experiences, they say. And all this causing many to turn to the streets, in some people's opinion.
Yeah, CBS 21's Andrew Klein is at the Children's Home of York talking about a new initiative hoping to change the future of generations to come in that area.
The state of Pennsylvania faces a shortage in mental health services, according to the National Alliance on Mental Illness, and oftentimes it leads to children getting into wait lists to get the mental health services they need. But in central Pennsylvania, there is a new service available, and officials hope that it will help keep kids off the streets.
We serve a number of different kids, like 0 to 21, and they have experienced a lot of difficult things in their lives and they needed mental health services, but they were either on wait lists or maybe they were looking for a different therapist to better connect with, and they weren't able to get those services.
When you have people that are juveniles that have experienced some of the things that these juveniles have experienced that we deal with, then you would understand why, number one, why they have mental health issues.
The Spark Center, a new addition to the Children's Home of York, featuring mental health services serving ages 4 and up.
We're offering individual therapy, group therapy, family therapy, and we also offer psychiatry services. So we're doing psychiatric evaluations and med management.
One of the things we do now is we're very transparent with our juveniles, and we talk about how us adults in the work field, have had mental health issues, how we have therapists. So, we idolize getting the help.
According to the National Alliance on Mental Illness, 193,000 Pennsylvania adolescents experience a major depressive episode each year. And because of current access to services, many go untreated, and that leads to kids taking to the streets. But with access to more services at a younger age, those numbers will hopefully change.
I believe that we will see less violent acts when it comes to our juveniles due to their mental health being treated. I believe that at least 80–90% of the acts that our juveniles, the acts that they are doing is because of mental health.
Devin also tells me that connection is a huge part of development for children, and connecting with just one person can lead to kids asking for help that sometimes they're afraid to ask for. In York County, Andrew Klein, CBS 21 News.
So there's a program that's focused on keeping kids off the street and really addressing some mental wellness problems out there. Andrew Klein is talking about this. He's joined us for a conversation about this organization right now. So let's go back a little bit for when they decided to start this new way of trying to reach these kids. How did it start?
Yeah, Joel D. So the Children's Home of York has been around for over 100 years, but the associate director who I spoke to earlier said, she realized that their kids just don't have the right access to mental health services. So they created a new branch. That is what is now being brought here. The Spark Center is a brand new part of Children's Home of York. So it has, licensed mental health services for kids 4 and up, something that, a lot of kids don't have access to in this area right now.
How are they tying this new program, mental health, with current violence that kids are either experiencing or committing themselves?
Yeah, well, I spoke to the GVI, the Gun Violence Initiative project manager earlier today of York. That's Tiff Lowe. She told me a little bit about the juveniles that she works with. She says a lot of them have a lot of mental health issues. So the important thing that we can do is try to address those problems at a younger age. This way, kids are addressing their mental health. They're talking through it with therapists. If they need to, they can get medicated as well. This way, as they get older, they're not leading to a life that leads them to the streets or puts them in danger or leads them to create that danger.
Do you know how they end up getting there? Are they just going through normal assessments even if they don't think they need the help, or do they have to seek it out and then that's when they talk to someone?
I believe it's something they have to seek out. It's something we can confirm how they do it exactly here at Children's Home of York, but we really just talked about what the service was. So that's a question that I'm also going to hope to have answered as well soon.
What age range are we talking about here with the kids and teens they're helping?
Yeah, Children's Home of York serves kids from ages 0 to 21. The ages listed in their mental health services are 4 and up, but when I spoke to them earlier today, it was pretty clear that if somebody needs some sort of help, especially, you know, a juvenile, a youth, a kid, they can come here, and they're going to figure something out to try to work with whoever they can to address those mental issues, however they need to do so.
It'd be interesting to track how many people end up taking advantage of this opportunity. Thanks a lot, Andrew.